much. Thank you for coming in to have us interview you. My first question is, how did Shahrzad feel when she got the news that she had this illness? What was her experience? What was going through her mind?
She handled it pretty good. She had this talk with her oncologist for half an hour. It was just me, her cousin, and the oncologist in the room. She took it very well to a point where I thought maybe she's shocked of the news and she's just gonna come to her senses and understand that this is a very serious disease. She was diagnosed with AML leukemia, and this was something that was very serious. But as the time passed on, I noticed that she really took it well from day one.
How did she receive the news that her chance of survival at the end was very slim? Did the doctor just give the news and walk away? Was there any support that she was given?
See, at the very beginning, when she was diagnosed with leukemia, they really didn't talk about the chance of surviving and what sort of chance she has and not. They were just talking about the treatments and the steps she needs to take. And at the very end, I would say probably the last 2 weeks of it, that's when they came and said that they couldn't treat the infection. And that's when they said that they might not be a chance of her surviving. But this was not a talk that they had with her at the very beginning. They were only talking about her options of treatments and how she can hopefully get better and how long this whole thing will take before she's treated. So it was not a talk about the chance of surviving at the very beginning.
What was the environment like in the hospital that she was in? Was it very plain? Was it kind of cool feeling, like cold?
I'm glad you asked that question. See, as far as being clean, I think there are standards that they need to follow, and I don't think that there was an issue with that and everything was fine. But as far as having a cool, relaxing, comfortable place for patients, I had an interview a few months back and I really objected to that, and I believe that hospitals should be relocated from downtown Toronto to the suburban areas, just because that would create this place where people would be more comfortable. It would be easy to get into, drive into. Probably comes with a free parking because the land that they're going to build these hospitals on will be so much cheaper, and also they can come up with more green space. Green space is really going to help the patient as far as knowing that the treatment that they're getting is in a place where they feel comfortable. It looks like a very cozy, comfy place. It's not in a downtown Toronto where there are cars honking, traffic, pollution, and it's in a more comfortable area where people just feel right at home. So I think as far as having a cool, comfortable place, she wasn't experiencing that, and a lot of patients don't experience that in Toronto because most of them are, again, located in very high traffic, polluted, populated area of downtown Toronto.
Do you think that if maybe they had not given her the statistics that only a certain number of people survive, that maybe she would have fought harder?
I really don't want to say that she would have survived because, again, I wouldn't know. But again, knowing that her disease was progressing and her lung infection was also getting worse, at the very last 2 weeks of it, when they came and said that the lung infection, there's no cure for it, we tried everything we could and we're just running out of ideas, they stole that very last hope that she had. She knew that she had the lung infection. She knew that the disease is progressing and there's nothing that they can do. But she had hope. She had hope until the very last day. She believed in miracles. And they took that miracle away from her by saying that, you know what, there's nothing else we can do. We did what we could, and there's not much that we can do from this time on. So I think she lost hope. And she had hope. She lived with hope. And stealing that away from her really gave her the last punch, and along with not having a great health, really that last punch took a lot from her.
So you had mentioned how one of the nurses were especially kind to Shahrzad while she was going through this process. Do you think that by saying it's okay, you'll get through this. She was offering her a false hope. And how do you think if she was getting a sense of false hope, how would this have affected her?
I don't believe in giving her false hope. False hope maybe as far as hospitals not being sued. Maybe this is some sort of a terminology that they use and they teach nurses, so they won't go on and talk to patients and giving them any sort of hopes. But again, I don't think a patient pinned to the bed, waiting, knowing that she doesn't have much of a chance, giving her hope is such a bad idea. False hope is something that you don't even know what the outcome is, and you go on and promise something. I am a firm believer that right to the very end, miracles could happen and would happen. So what she was trying to do was doing her job and going beyond it and giving her something that she didn't get much of in the hospital, which was hope. Again, nurses used to come do their job based on the chart that they were supposed to follow, based on the medicines that the patient was supposed to be getting from the nurse, but they were just leaving the room right after this was done. I think she was going over and beyond. And again, she was probably trained in the same nursing school as every other nurse in that section. But she decided that giving hope is really have this ingredient in it that might go on and beyond all the medicines and all the pills and do the magic. And again, it did the magic because again, I'm talking about Shahrzad, she was so boosted up when she was in that section working in that hospital. And she used to get upset, and I used to see that in her. She didn't want to walk, she didn't want to get up and eat, she didn't want to talk to anyone, she didn't want to have any visitors, and it was all because of that one nurse that was not working for that few days. So if this would affect a patient to this level, I don't think you can call it false hope. I would say it's hope, and it's in a great level, and it's at the timing that is well needed. And again, coming from me, I think that hope played a bigger role than any other medicine that she could have taken at that time.